we will talk about Asperger disorder. It's part of autism spectrum disorder and also known as high functioning autism. It's called high functioning because such kids have no language delay and they have normal or above average intelligence. That's why it is called high functioning. And now let's say examples and most important characteristics of Asperger's disorder. First is repetitive behavior. For example, kid will order these toys, and if there is even smallest changes, this kid is distressed and cries and can't control his behavior until and can't focus on anything else until this even smallest change will resolve. And if he fix and order these toys again, he will stop crying and he can focus on different activities, but before it he focused only these toys and this order. It's part of repetitive behavior. Another example and another part of Asperger disorder is deep interest in specific topics. For example, this girl is highly interested in jellyfish, and her room is full of images of jellyfish everywhere. He reads books about jellyfish. He watches documentaries in her laptop about jellyfish. She reads articles about jellyfish. So she is totally surrounded. She is excellent in this topic, but maybe for her everyday conversation is much more difficult than to be expert in her field and in her niche. So such people with Asperger disorder have deep interest in specific topics and specific niche. Another characteristic is good intellect, good language skills, but difficult understanding of verbal cues. For example, for them it's difficult to understand the jokes because they get and they take it directly, literally, and they for them it's difficult to understand idioms also. For example, if this boy telling him about his work that you wrote whole book about today's homework, and this boy answering that he only did what was needed, not whole book. So he did not get this joke, but he understand it literally, and it's problem for such people that they understand everything literally, and for them it's difficult to differentiate joke from normal talking. Another part is failing to recognize when the listener is not interested. So they can be very passionate about the topics they are interested in, but they can't recognize when listener is not interested and when listener is not listening at all. They can't recognize this emotional and body language part. Although such people have very strong sense of fairness and justice, and they have also empathy, many cases they fail to express this empathy, but they have strong sense of empathy also, but expression of it is difficult for them. Also failing eye contact, for them it's difficult eye contact, and it's one of the first sign how mother can suspect that her kid may have Asperger disorder. Also such kids playing solitary outside from other kids, and their playing is different from other kids also. Sometimes they failing dexterity. It means for them it's difficult to stacking blocks, for example, or holding a crayon correctly, or walking independently. Sometimes they are clumsy and they start walking maybe in 18 months or later sometimes. but their language skills usually good and usually timely and not delayed. Also, they have sensory sensitivities. It means external noises, for example, vacuum cleaner or chopper or any other noises can cause their sensory sensitivity. They can cover their ears from this noise and start crying. Um, Now let's say about statistics and demographics. Asperger affects around 0.5% of population. It's more common among males, but females also affected. Prognosis is good because there is no direct correlation between Asperger disorder and lifespan. They live normal lifespan, and many of them well adapted in society, but anxiety disorder is much common in person with Asperger disorder, and there is no cure for Asperger disorder. 60% of people with Asperger disorder have anxiety disorder also. Treatment is cognitive behavioral therapy, and it's very individualized, and this cognitive behavioral therapy should be tailored to the specific problem. For example, if person has repetitive behavior, he should understand this part of his or her action. If there is difficult to understand jokes, you can work on this specific problem, and etc. So treatment is cognitive behavioral therapy, and usually such people eventually are well adapted. If treatment is started earlier, result is better. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.